Dr. Joel Zinberg is at the Competitive Enterprise Institute, where he's a senior fellow. He's the director of public health and American well-being and the American Well-being Initiative at Paragon Health Institute. He joins us now. Dr. Zinberg, thanks for being with us again. Appreciate it.
Good morning.
Anything else you want to add to the leprosy thing, or did I pretty much cover it? I don't have a medical degree, so I just want to.
No, don't. I have nothing to add to the leprosy thing.
Okay, very good.
Well, they said it's transmitted through coughing.
Pardon?
They said the CDC, which I don't believe anymore, said it's transmitted through coughing near a non-infected person.
After you've been bitten by an armadillo. So if you just deal with that first problem.
Well, I wouldn't. Let's leave the poor armadillos out of it.
Well, they can carry it, so you know.
All right, if we can, not create a national frenzy over leprosy. So you over at the Competitive Enterprise have a new paper that provides a blueprint for refocusing the CDC after COVID-19. I mean, as they sort of rearrange the deck chairs over at that Titanic, I mean, this is a nice white paper with some good ideas, but what's the possibility that anybody over there thinks that they need a refocusing?
Well, look, we said that even the CDC has acknowledged its multiple failures during COVID, but the problem is their diagnosis of what the problem was is way off. We, in looking back at the history of the CDC and examining what happened during the pandemic, we singled out the problem as mission creep, where the CDC has grown rapidly and haphazardly over the years, abetted by the fact that there's no congressional authorization for the agency, into this enormous agency with multiple diverse centers and institutes that they're separated from one another. They have very little to do with the core mission of the CDC, which is supposed to be to combat infectious diseases. In fact, only about 8% of the CDC's workforce is engaged in traditional efforts at identifying and controlling biologic threats. What they're involved in now are things like the public health consequences of the climate change, reducing racial disparities in healthcare, addressing social determinants of health, increases in injury and violence prevention programs and gun violence, none of which is really their expertise, their forte. And we think that distracted them during the pandemic. They were unprepared to deal with an infectious disease threat. And when the pandemic actually came, they did a terrible job at combating it.
Well, that's the second piece of that. Yeah, it could have been distraction, but does distraction really explain the sort of repetitive dishonesty and high-handedness that you saw from the face people at CDC, from the director to Fauci in particular?
Well, Fauci's not a CDC, so let's make that
NIH, yeah, but I mean, they're all sort of in the same bucket. I mean, fine. So Collins and Fauci, they're collaborating. Walensky,
well, look, so right away,
what's the difference?
Right from the start of the pandemic, they were supposed to be collecting data and sharing it with state authorities. In February of 2020, they were supposed to have this system that would warn local health people about potential travelers who might pose a risk. That broke down in the middle of February, and they just told the states, "Well, wing it, let the people go. You don't need to control anyone." They impaired our ability to test right at the beginning of the pandemic. So for the whole month of February, we had no good testing in this country. They, as you pointed out, they had faulty science throughout. They couldn't communicate with people. All sorts of communication problems throughout the pandemic. So why is that? Well, it's because they were looking at all these other things. The CDC did its own report on its failures during the pandemic called Moving Forward. And they very proudly say that when Dr. Walensky came into office, one of the first things she did was to address social determinants of health and racial disparities. Like, we're in the middle of the biggest public health crisis in 100 years, and that's what you're focusing on?
Well,
I mean,
right.
that's what I mean by a lack of focus.
Yeah, but when they were focused on COVID, what were they doing in the early days? They weren't focused on what they were unprepared to deal with. They were focused on trying to shut up. This is Collins and Fauci per emails, trying to shut up people who were suggesting that the origination of the virus was from the lab rather than the wet market.
Yeah, no question that Fauci and Collins were doing that and trying to distract us. But Fauci and Collins were not at the CDC. The CDC had its primary mission is to protect us against infectious disease, and they were not doing that. Now, it didn't help that you had people like Fauci and Collins who were trying to hide things and changing their public pronouncements every other day. First, masks were not necessary, then they weren't necessary, then maybe they aren't, maybe they are, stuff like that. That didn't help, but the CDC is supposed to be the authoritative voice, and they just weren't there.
Well, right.
Well, do you think we need them, or should we just abolish
Wait a second. Where was Redfield, too? I mean, I want to name names. I don't like. We need to go back and make sure that specific names and specific positions are held to account. So, I mean, you say, Fauci and Collins or NIH, but Redfield was at CDC, then Walensky was at CDC, and all of these people need to be held to account. I know Redfield now, in congressional testimony after the fact, is sort of separated himself from what Collins and Fauci were doing, but that doesn't absolve him from what he did or didn't do during the 3 years he was there.
Right. Well, look, there was an awful lot of internal fighting and politicking going on, and Redfield's explanation, and I'm not saying it's true or not, is that he was sidelined by these folks. But Walensky was not sidelined, and Walensky, I think, made lots of pronouncements that were of dubious, truth during the. The CDC was failing in its goal. It's supposed to be a scientific agency, but when messages conflicted with what the political message was that that the administration was pushing, they were allowing really crappy science to be published under the name of CDC. Basically glorified case reports were being presented as if these were definitive trials and that we ought to rely on them. Meanwhile, they weren't commissioning the studies. They should have been commissioning studies right from the start about who's at risk, what can we do to stop it. But instead, the U.S. ended up relying on a lot of research from overseas. It's no surprise that the Israeli studies were much more relied upon than anything in the U.S. because the CDC wasn't doing the studies it should have been doing, and instead it was relying on studies that reinforced the administration's point of view and the type of message that Collins and Fauci were trying to push.
But also, too, they became so politicized. I mean, you had Michelle Walensky out there saying it's safe to reopen schools, and then bam, less than 24 hours, Randy Weingarten, head of Teachers Union, got to her and said, no, we're not going back. And she changed her tune. I mean, is anybody going to be charged criminally with this?
Look, I don't think, particularly not with this Justice Department. I think we already know they are engaged in some very selective prosecutions. I don't know that there's, criminal thing, but it's certainly from the perspective of public health that you would rely on the head of the teachers union, whose members didn't seem to have the well-being of their kids in mind. I mean, the CDC has to be a scientific voice, but they're not, at the end of the day, they are not the decision maker. The decision makers have to be able to balance the costs and benefits of any policy. And some of even if the CDC's advice had been 100% spot on scientifically, you then have to look at what are the economic side effects, what are the social side effects, what are the effects on kids about keeping them out of school for 2 years. No one was there doing that, and that was missing. Now, it didn't help that the CDC, though, was distracted and was providing crappy scientific advice.
Yeah, no, that's right. Yeah, that's a pretty good summation. Dr. Joel Zinberg, Competitive Enterprise Institute Senior Fellow, Director of Public Health and American Wellbeing Initiative at Paragon Health Institute as well. Dr. Zinberg, thanks as always. Appreciate it.
My pleasure. Thanks for having me.